who knows nada. My name is Brianna, and this is the Mama Knows Nada podcast. I'm so excited to invite our next guest, Dr. Mayredlis Cruz. She's a chiropractor in St. Augustine, Florida. Fun fact, her husband is actually my chiropractor, so full disclosure here. I asked her to come on today because she specializes in prenatal and postpartum care, so babies and moms, and I think that's a really important topic to talk about. So, welcome, Dr. Cruz. Thank you so much for being here. And let's talk a little bit about why you got into chiropractic care.
Well, thank you. Thank you for the invite here. It's so cool to see more moms talking about motherhood and kids and pregnancy. So that's awesome. Why did I get into chiropractic care? So before chiropractic, I was set into medical school and going into OBGYN. That was have always been my passion of working with pregnant patients. But at the time, I kept researching, and then I was like, okay, what about pharmacy? What about medical technology? I started my master's in biotechnology. But like all those things, like it was like, how am I really helping this person to achieve health, or to what I feel health is? And it was like a whole loop of, if you become a doctor, you can diagnose, and if you diagnose, you have either medicine or surgery, and then we do it all over again. So that for me wasn't the health that I was looking for, until I met a chiropractor while I was pregnant with my first kid. And he explained, what chiropractic was. And it was like, wow, this is awesome. Like, I would love to study this. And he said, do you want to get adjusted now that you're pregnant? It's so important for you, for baby, totally. All this stuff. And I was like, no, thank you. Because chiropractic at that time for me was new. So I was like, no, you're not touching my baby, my belly. Like, this is the most precious thing. So, like, I even though I love their philosophy, right, what they were about, at that time I wasn't prepared to get an adjustment. Long story short, my best friend started under care, visited Life University. That's where we went to school. And when she came back, she was like, oh my God, this is amazing. Chiropractic is what we've been looking for. Like, you have to go there. Please visit this school. Blah, blah, blah. I said, okay, let's go. I did they're called like a leadership weekend, that they show you all the facility of the schools, and you can get to talk to another students, another doctors, and ask questions. It was an amazing weekend. And after that, I said, okay, I'm sold now. This is the career I choose to do, because again, health wise, it's what in me felt right.
I think that's really important, because we're going to talk about like health as a whole, and what you're saying, that cyclical pattern of like diagnosis, and you can only do so much, and you can only take the patient so far. So in that kind of frame of reference, there's a lot of misconceptions around chiropractic care, what it does, the setup, the diagnosis, and also like the care plans. And I didn't even think about chiropractics during pregnancy. I'd never gone to a chiropractor until I was pregnant. And then one of the OBGYNs I was seeing, this was when I was in Dallas, in our practice was like, have you ever thought about this? You should do, like, if you're in holistic care, because they kind of knew I was like, I don't want to do anything that's not like organic. Like, you should check this out. And I was like, oh, okay. I didn't know that was something I should do. So can we talk a little bit about misconceptions about chiropractics in general? And then maybe a little bit about what are they for women, especially pregnant women, postpartum, like prenatal and postpartum. That's like 3 questions.
Okay. That's like 10 questions in one question.
You're welcome.
So overall, let's see. Overall, you only go to a chiropractor when you're in pain. I think that's the biggest one, that people go to the chiropractor because they're in pain. And in the body, pain is the last things to show up when the system is already broken or stressed. But also is the first thing to go when we start like reviving the system back also. So that's also sometimes when people are like, okay, after 1 or 2 adjustment, I'm good. Not really, but I mean, it's okay. Whatever, the person is in their path of healing. So like really, if you go from the premise that chiropractic increases function in your body. And what does function mean, right? Because I feel like it's function. But like, I mean, for you and me to be talking right now, your nervous system is working. For you to understand, right, what I'm saying, for your heart to beat, do your digestion, for like all these processes that are happening inside my body right now that I don't have to think about doing it. That's the function part of what chiropractic does. Increases your function, increases your ability to adapt to your environment so that your heart, your digestive, all your vital organs can work properly. So not only for pain goes away. We're great with pain, neck pain, lower back pain, all pains, migraines, headache. Yes, we're very good at that, but because of that, pain is the first thing to go away in that healing path. Let's see. If I go to a chiropractor, I have to go forever, for life. That's a big one too. I've had people say, no, I don't go to you because then once I'm there, I'm for life. Again, chiropractic for me is a lifestyle. My family gets adjusted every week. And it's kind of like, so if you have somebody that has eaten burritos all their life, never brushed their teeth completely, like they're only, this is so good. But once you show that person, hey, use this toothbrush, brush your teeth and see how awesome your mouth, your teeth are gonna feel. And then they're like, whoa, oh my God, right? Like, this is so great, my clean teeth. Then I'm gonna go back to my burritos, but now I'm brushed my teeth. So it's the same. Once you get that first adjustment, people feel like their response is like, I feel so much looser. It's like that layer of stress or toxins or whatever your body's not needing. It's that release of that. So do you have to go forever? It's your choice at the end of the day, really. Like however you're choosing to use us, you're welcome. Like if you want to do just for pain, we're going to go just for pain. If you're choosing to go and give your health like a next step, then let's go into the next step for your health. So do you have to come forever? No, it's a choice. Let's see, because I'm like
that's
for
a good
adults
point.
too. Like there's so many people that they don't know that pregnancy, you can get adjusted through pregnancy, and your kids can also get adjusted. Baby, like when is the first
Right
good
after
time?
that, right after that.
Just right away. They're a newborn. Yeah. My kids were adjusted like 15 minutes out after they were born. And with the second one, I told my husband, I was like, oh my God, it's been like 24 hours and we have an adjuster. So sorry, it's like I have one of my daughters right there.
Aww.
Just woke up. Let's see. For pregnancy, it can hurt the baby. Another misconception, because if it does something, it's great things for you. Like there is no way that from an adjustment you're gonna hurt your baby. Again, if we're talking about layers of stress and increasing function, that's what you would wanna have while you're pregnant, because you're growing a human being. That requires a lot of work. So if you are like already, stressed because you're growing a baby, and it's stressed because of your job, or you have other kids, or you have all this stuff, chiropractic can again release that stress, improve function for you and baby. Let's see. Chiropractic is not needed. Which again, everybody, right, with their, everybody has their own opinion. I feel that first adjustment, the newborn adjustment, is the most important one for kids, because again, it's like giving them like a good kickstart for life. There are research that have shown like 80% of babies come out with a subluxation. That's what we call like nervous interference in the spine. So even though your APGAR score is like 10 out of 10, there still can be some stuff in your
kind of makes sense. Makes sense.
The birth is trauma. Yeah. Birth is a trauma. However it was vaginal C-section, or like however you give birth, it is still a trauma. You don't know how long that baby was in there. You don't know how long mom pushed, if she was given IVs, if she was given epidural, Pitocin, like everything that happens during that the birth. It can cause some stress for the baby too. And then you can adjust them and again, release
otherwise you're just building upon it. It's really interesting you said that. I was talking to a friend a couple weeks ago, and her son just had, and I can't remember the diagnosis exactly, it's not autism, but it's some kind of sensory disorder. And she asked about how it was diagnosed and what caused it. They say research, and it's like very infantile research, but is linked to birth trauma. And you think about it, like what you're talking about, there's all kinds of trauma. We don't think about birth as trauma. We think about birth as an experience and bringing new life into the world. And this is beautiful, blah, blah, blah. And it's fine. But in my personal experience, my birth was it wasn't traumatic in the sense that I had to have an emergency C-section or anything like that. I did have to have, Declan was vacuumed out, so we had a cone head. So the doctor, the chiropractor I was seeing when I was pregnant, she's just like same specialties that you have, and we'll get into that in a minute, but she had to reshape his little baby head because, and she adjusted him. She's like, I don't, what you're talking about, don't feel any other things, any other issues. But had I not had friends who had had other problems with delivery, like one of my friends delivered her son sunny side up and he had torticollis, he needed to be adjusted. So if I didn't know, and you have to know to go see a specific person, you can't just go see anybody, because just with any niche and any kind of healthcare provider, some can do things that others can't. Like you can't just go to any chiropractor for your kid. Like you have to go to somebody who knows how to shape the cranium back and who isn't going to hit the wrong spot. You know what I mean? Like there's a reason that babies are delicate, right? Like don't drop them on their heads. Like don't touch their heads. Like we all know those things, but so you have to go to a specialist. But all of these things you don't know, you need to know until you're like, oh shit, like how do I go? So fortunately for me, it all just plays into your point about what's required at birth, what happens.
Even through pregnancy too, because that's another thing that I feel the medical world has made pregnancy like a disease now. You need to do a certain amount of labs, and you need to do a certain amount of ultrasounds, and you need to do they're monitoring so much that it's like, this is a miracle what's happening here. Why do I need to be, which in some cases I understand completely, but others really that's putting again that stress on mom and saying you can't do this. This is too much for you. You need all of these things in order to have a healthy baby, a great birth. Which again, in my opinion, we are born to create life. That was something God given. Like why? And so I feel like now it's taking more something wrong with you. Let's see in the next appointment what's wrong with your baby, instead of you're creating something. We're going here and somewhere this is so happy. Like imagine your birth. What's gonna happen in your birth? No, but then also you have all these other misconceptions about birth and all the fear that you can get from birth too. I mean, for me, I have 3 kids. The first one, they told me that my placenta was getting old and I needed to give birth. And by then, yeah, exactly. By then, I was so young and I trusted my doctor. And I mean, they know better than me that I know nothing about birth or babies or anything. It was my first one. So I went ahead and I had the induction first time. I feel today that that was all unnecessary procedures. It was great that I didn't end up in a C-section, but I was induced, like it wasn't, he didn't allow me to have my contractions and to have my birth.
It's interesting that you say that because I was a high-risk pregnancy of a history of blood clots. And so I trusted my doctors, all my friends and family at this time. I was again in Dallas, so 1,500 miles away. And in retrospect, if I would have done it differently, I loved my doctor. She was incredible. And she listened to me. I said, I don't care what you have to do. I'm not having a C-section. There's no way I can be bedridden for 6 weeks. There's no way. My Dom was on a business trip the next week, so I didn't have a chance. 5 days later, he's on a plane, so you got to move, girl. And I'm like, I'm not going to be stitched up with a 5-day-old with no support, And in retrospect, what you're saying, I would have done the same thing. I was induced and I didn't have any complications. Like, there's nothing that would suggest that I was like going to bleed out or whatever. I would do, knowing what I know now, would do it differently 100%. And I would trust my body because I don't respond well to medications. So for me, having all that, like everything that they give you for pain in pregnancy, I had a reaction against everything. By the time I had my epidural, I couldn't feel anything, so my body could like relax. But by the time I had to deliver, I felt every push. I felt every contraction. I was like, there's a contraction coming. They're like, no, there's not. I'm like, yes, there is. Don't tell me what I feel. Like, you can feel that? I'm like, yeah, I can feel that. So that was a waste. Glad we paid for that anesthesiologist because that was worth it. But I think sometimes you're right, and I like what you said there too about making it what's wrong with your baby instead of like what's right with your pregnancy. Like everything's great, it's so wonderful, but every time you go into your OBGYN, and this is not to slander or dismiss the talented doctors out there, it's just in retrospect, that's what you feel like, oh my God, is something going to be wrong this time? Like, is it going to be okay? Like, am I going to be all right with it? Anyway, so I think that's a really good transition there to kind of say, like, maybe we should change. We should have a transition on how we present that in any kind of healthcare environment. Like, you should be excited about what your body is doing as opposed to fearful about what it may not be capable of. And maybe we would have a lot more successful births and not so many C-sections.
Yeah.
I want to get back. Oops, for real. I just kicked myself to about kids and about how chiropractors are good for them. Because I didn't see a chiropractor until, again, I was pregnant. And now I don't know how I lived without one. And I mean that wholeheartedly, especially after carrying a baby, like what you're saying, the aches, the pains, like you're rearranging your organs, literally to create this life.
Yes.
So how can starting chiropractic care, like you said, from day one really benefit our kids going forward?
So again, let's talk about stress, right? So the baby was born, but through pregnancy, how stressed she was, her thoughts, like all her experience through pregnancy affects the baby. Babies are already forming memories in utero. So like you are unwinding all of this stress and trauma that is coming from mom and dad, or mom and the family, mom and with the world, and then so unwinding of that emotional stress. Then you have the physical one, because however the birth was presented, the babies can have tension in their necks, in their sacrum, lower back. And then that all, again, once you clear out those interference, once you clear out the nervous system, then that baby is more prone to have in the future, like now it's like everybody has an ear infection, everybody has colic, everybody comes out with reflux. Like all of these cases is like more and more and more that I see. Why? Again, that nervous system is so charged with stress that the body is not functioning the way it should be supposed to be functioning. So it gives also that opportunity of, if you have a body that is functioning how it's supposed to, then you're less prone to get sick or to get any of these conditions. Because disease, if you separate, is this is. So every time we adjust, we kind of bring ease to your body. So when your body is in this ease, that's when symptoms shows up. That's when colic is there, reflux, constipation. I mean, you name it. That's when also I tell moms, look, I'm not taking care of your reflux. I'm not taking care of the constipation. I am making sure that this nervous system is completely out of nervous interference. Have the system free of subluxations or nervous interference. And then you see miracles happen. Because for you to tell me that you got just a baby and then right away they poop, or just a baby and that mom say, oh my God, he had like an 11-hour nap. That's a miracle.
I'll take that.
and with use of no meds, like nothing external needed that baby to have an 11-hour nap. It just needed a body, a spine without nervous interference.
I think so, yeah. So what you're saying is I need to come twice a week? No, but really, I mean, I don't know. I say that again, like I'm an advocate for chiropractics. Like no one's paying me here for that. I don't know. Like I can feel it now. I'm coming in tomorrow. I can feel it in my lower back right now. Like, okay, gosh, I try to wait till like after a big run, or like tomorrow I play tennis, so I come in because I'm gonna hurt. But anyway,
yeah. And with everything that you do in your life, you can find like after being under care, things improve. I mean, I had a patient coming for a shoulder pain and her anxiety. Like she said, I'm not taking any anxiety med and I can fly without any pill. I was like, wow, that's awesome. So if that is an adult, like what can I do for
I love
babies,
that.
For kids?
Now,
and that was another reason why I started all my specialization with kids, my focus with kids and pregnancy, because my nephew was diagnosed with autism. And I mean, I saw him doing all, therapies and medications and this and that. And I said, look, I'm going to adjust him because I know the power that made the body heals the body. And if we have that nervous system free of any interference, things happen. So, I mean, for a week, I was adjusting him like almost every day because she was out. She was flying somewhere else. And when she came back, she saw a whole new baby. And then that's why I was like, wow. Because at the beginning, like I said, I met the chiropractic when I was pregnant. I didn't believe in chiropractic. I was like, I don't know what you're doing. You're not touching me. But now with seeing the result that I got with my nephew, it's like, wow, like why other providers are not recommending chiropractic care?
Oh, that's a different topic for a different day.
Yeah.
Oh man. Oh gosh. I was just talking about that with my husband.
But we're getting there. There are more awareness.
Let's talk a little bit about your specialties too, because I think it's important to, again, you can't just go to any chiropractor to get, especially like prenatal, postpartum care, as well as care for infants. So what did you have to do to be able to care for pregnant women as well as babies?
So I am part of the ICPA, International Chiropractic Association, something. ICPA for short, which they offer a certification in pediatrics and prenatal, and it's like 200 hours of lectures and practice, and you also can do Webster technique through them too, which that is the one technique that is used for pregnancy. And then I did another training of cranial sacral therapy too, which that is more head and bottom, which I also can use in adults, and it works, but it's babies. And then any extra seminar, like I love that, so I'm always like a nerd looking, for more.
Awesome. I think that's just really important to have people understand that it's not just any chiropractor. You have to go to certain trainings. Part of the reason I chose y'all's practice when I moved to St. Augustine was because you were there, and if I ever decide to have another kid, well, I need someone who's trained in the Webster technique. To adjust. Sorry, Dr. Adam. No offense.
Oh, he's fine with that. He loves me taking care of pregnant. He's like, no.
I get it. But I think it's important to understand that people, it is additional time. It is additional training. It's not like anybody can sit there and manipulate a pregnant woman's body, because you have to be able to feel and find things.
Yeah.
We've talked a little bit about how you have 3 kids, 2 girls and a boy, and you're a business owner. What is the hardest thing about being a mom and a business owner?
The hardest thing. I think the hardest thing, which I'm getting better at that, is like trying to be perfect. Trying to be perfect for, for my patients, for my kids, for my husband, like trying to do everything, things should be this way, A, B, C, 1, 2, 3. And, if it's not like this, then I failed. Which life happens, things, life is. So I am learning to relax and to watch miracles happen. Really, because, and then the other thing is like you're always busy, you always have something to do, and having that mind, kids, business, what do the next, next. That's why I need chiropractic, because I need to keep my stress levels down.
All the things, right? I think that's important, though. That's an important thing to say. It's like, because it is nonstop. Like whether I'm a writer, and I can work when and how I want to. And, when you have patients, you guys strategically plan your schedule to have days off and stuff like that. But you're both in there together. So there's still always something happening. When it's your business, that's your other baby. So you kind of have like 4 babies. Yeah.
Yes. Well, 5, because we just got a dog. So now I have 5.
That's like having another toddler right there. Seriously. I remember getting our dog. I was like, oh my gosh, that was like the best. Got him when he was 4 months old, and I was like 5 months pregnant. So it was like preparing me for having a child. Wow. What do you enjoy the most about your career?
Working with people, adjusting. That right there, adjusting and giving them hope, like giving them the information, the education that there's something else to what they're going through. There is a way to get out of all this, mentally and physically, giving them that. It's amazing to see then the results, to see mom saying, wow, if you didn't tell me this, I would have felt blah, 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 blah. Or, wow, I feel so much great. My pregnancy has been so much comfortable. Like, I don't know how people don't get adjusted to pregnancy, that sense of thank you. I am very grateful for the patients that I have and for the information that I have in my mind that I can share with others. That I enjoy.
That's awesome. Now, what do you enjoy most about being a mom? Enjoy most about being a mom?
What do I love? Being silly with the kids, being a kid again. Because we dance and we sing and we play, and so really just seeing their happiness again, their joy in their faces, you know, have little things that look up to you. That part again, it's worth it. All the pushes and contractions and all the nights, it is all worth it.
I love that how you guys as a couple have sometimes your family, your kids are there. It's actually really kind of fun sometimes, especially the little one, Sophia. She comes in and she's also curious and she's like, "Hey, how you doing?" You know, I mean, she's not talking yet, but it's kind of been interesting to see her grow as like a patient, you know, and to have that flexibility, I think is pretty cool, you know, like not everybody gets to bring their kids to work all the time or, you know, be present for them.
Yeah. Which that have both sides too, because having your kids with you all the time can be something interesting too. Because sometimes I choose to focus with my patients and I have 3 kids in my room with my patient and I have to say, excuse me.
Go find your father.
But he's a blessing.
Yeah, most days.
Yeah.
Most days, I'm sure. Now, because I keep referencing your husband. How is it to have your life partner as your business partner?
If you asked me that question 3 or 4 years ago, the answer would have been very different. Though I say it because when we opened our office, we were going through hell with our marriage and our business, our kids, like our story. Like people say, oh yeah, they have like, you know, they feel this office, but they don't know what's going on in the background. So we were trying to build a business while arguing with the marriage and the life. And I mean, we were living with another family member in the same house. So talk about stress. But after doing we started doing some emotional work. We started doing a technique that is called the quantum leap technique. That I feel, I know for sure, saved my marriage, saved me, saved my business, saved the way how I view life now. So before I would have said having your partner as a business, horrible, don't do it. Now that I truly can say I love my husband, I love my practice, you know, I love being there, is the best thing. Because, I mean, I would say like everything but we're just talking about the business. We talk about patients all day. So sometimes turn that switch off. Hey, we are now in the house. We're not in the office. That would be like the thing. Yeah, it can be challenging. But once you understand and change your perspective, it could be a great thing. I mean, you are your own boss, and he still calls me boss. So I'm boss everywhere.
Yeah, that sounds good. But I like that you're honest about that. I think everything is a journey, and I think everything takes a lot of time and thought, and sometimes you can't get there. So I like that you're being honest that, you know, a couple years ago I would have been like, no, but doing the work, because work is important and work is different depending on who you are and what you do. But as a person, we're all like works in progress anyway. And so you can only do so much at any given point in time. And marriages are hard. Relationships in general are hard. Friendships are hard. Being a daughter or sister, whatever. It's difficult because you never feel like you're doing enough. But then when you have your own family, I don't know if you feel this way, but you kind of almost feel like your family unit is starting fresh again. And even though you have a mom and a brother and a sister and a dad and cousins and whatever it is, it's an interesting experience to be like, this is the family I created. And sometimes you don't like those people. You know? It's hard. It's hard some days. Like you can walk away from your friends. You can take as much space as you need. You can, especially as an adult. But sometimes it's hard to be with some people day in and day out. And then to add that layer of professionalism that you have to have in front of clients and patients. And, I think it could be just from the outside watching other people doing like, well, that looks tough. I don't think I could work with Dominic all day, every day. So kudos to you.
But you can also, you could also choose to be fun and easy. Again, we can change that perspective, because when you were saying like family, other family, sisters or friends or whatever, you say, I created this family. Yes. And you're also carrying all these baggages from all your experiences with all of them. And then you're putting into your family, which again, you created this. So you can also create the family of your dreams. It doesn't have to be hard. And it doesn't have to, be like, difficult, whatever. It can be fun and easy.
Dr. Cruz
once you
truth
choose.
bombs. She's cool.
I can do it. I can say it because I went through all that.
I think it's important to show that perspective. Sometimes we try, especially in our society, to have everything be cookie cutter, picture perfect, the right filter, blah, blah, blah. So you can see my lighting is not the best. I don't wear makeup when I do my podcast because this is what it's all about. Like, this is two real moms getting together and just being like, this is how it is. And you know what? Marriages aren't perfect. Relationships aren't perfect. They ebb and flow like seasons, and you have to make conscious choices, what you're saying to all of that. And it's so difficult, I think, sometimes to do it in general. But then when you have that partnership in a professional setting, it's even more dynamic, So I think it's such a testament to your work ethic, both personally and professionally, that you and Dr. Adam can create this, fourth child together, your chiropractic care, and make it, as functional and flourishing and like, a practice, because any job is hard, and a job with your partner is really hard. And you guys are doing it. So there you go.
Yes. It took some work. It took some time. But here we are.
Okay, let's get into a little bit of some of the useless things some about your pregnancy and your journey to motherhood. Was there any useless information or recommendations you received while you were pregnant? And this could be with any of your kids.
You're eating for two. You're not, it doesn't show that you're that big or how big you are. Or once the baby was here, are you sure that milk is okay? It looks watery. Are you sure the baby doesn't need formula? What else? The big one for me was the induced part, but let's keep that one away for now.
Those are good ones.
I think the one with the milk was a big one because, and that also I see with women with breastfeeding. Like sometimes you say, oh, I didn't produce a lot, or breastfeeding hurts, things like that. And then I had the experience of somebody saying, this milk looks like water. Are you sure he's getting the nutrition? Oh, the baby's crying too much. I think he's hungry. Give him some formula. No.
I love that stuff. Or you only need to breastfeed for this month. You only need to do that. You're just like, leave me alone. Stop. I'm going to do what feels right for me. Was there something you wish you would have been told about motherhood or becoming a mom, especially for the first time?
Well, for the first time, I don't know. After the 3 kids, I would say that nobody told me that my kids are a mirror of myself. So whatever is going on in them is going on in me. And if I am choosing for that to go away, I have to work with me. So they change. There's nothing wrong with
another
kids.
Good one.
Here, the stopping here.
I say that to Dom all the time. I'm like, sometimes Declan is reacting to us. So if we're having a bad day or a bad moment, or if us as a couple aren't doing well, he feels all of those things, you know, and they can't, like today, he was funny. He wakes up and he's like, I just crying all day. Oh, not crying, whining. I'm like, Declan, why are you so whiny today? I don't know, Mommy. And then 10 minutes later, still whining. I'm like, Declan, are you whining because you're not getting your way? Yes, Mommy. I was like, Declan, we can't always have. He wanted to like take the dog for a walk, but then he didn't want to walk, and all the things that toddlers do. And you're like, okay, dude, you can't always have your way. You got to get the dog out. I don't want to clean up poop on the carpet. you know, you can't have your way right now. You just got to get out the door. Stop it. But I get that. I think that's a really good thing, is that they're such little energetic beings, and they, especially when they're so little, they feed off of us in particular. And that was just really good. And if whatever, like you're saying, they are a mirror to you, and they really, if they're funky, you have to pay attention to that. Like really pay attention to that. I love that.
Yeah. I mean, have you heard like maybe at 5-6 years old, that's when your consciousness kick in. Like before that, it's all unconscious. So again, that's why, you know, the mirroring of us happens.
All right.
We can help with that too.
We're just going to highlight Lighthouse Chiropractics, etc. for this season, because they've got lots of things they can do for you outside of chiropractic care as well. Do you have any unsolicited advice for new moms or soon-to-be mamas?
Trust your gut. If whatever the world is telling you, if you feel that's unknown, stay with it, you know, trust your gut. And know that at all times, I'm sure you're giving your 100% to your kids, to you. So again, don't waste time on saying how bad of a mom I am, or how, you know, like go down on yourself because of stuff that you didn't know, but that you just learned. So again, trust your gut and know that you're doing the best.
If you don't know, now you know. That's a good song lyric. So
it's like there's some parents that say, you know, like they get so, oh my God, I didn't know, nobody told me, blah, blah. And I say, exactly. So if that was the reason why, then good thing that you're here now. You know, the good thing that you know this information now.
Amen. Amen. I'll just do a little tidbit on that. Like the car seats. When you first have a car seat, like, yeah, you might read everything in there, like skim through it like I do, because I don't read all the fine print of anything. And then you realize it's not tight enough, and that the buckle is not, the clip isn't, it has to be over the chest plate, because if you are in an accident, you're just going to puncture the lung instead of protect it, you know, like, but as someone, it was my chiropractor who was like, I carried Declan in his little bucket seat, he was sleeping, and she's like, you need to adjust this. And you're like, in that moment, you feel guilty, like, oh my God, I should have read that more thoroughly. But at the same time, thank God he's 3 months old and she's telling me this, because heaven forbid something, you know, to happen. So you just don't know until you know. And then when you know, you can do better. It's like that thing, once you know better, do better. That's like the metaphor for parenthood.
Yep. I always say, look, ask around, and whatever, you know, feels right, do it. There's not like a mother and dad manual. You need to do this. We're here learning from them and learning together.
There's a parent you think you're going to be. Like, I thought I would be like the fun parent. And I'm super playful with Declan, and we dance and sing and jump around the house too. But I'm also like the fun police. Like, I'm like, don't jump off of that. Are you sure you can, if you feel comfortable, and then I'm the one with all the boundaries. I'm like Captain Consistency. Every day you have to feed the animals. Every day you have to put the silverware away. And I'm just like, and every day I'm like redirecting. I'm like, nope, we have to do it. And it's like, I never thought I would be that parent. Like, I'm like, like, I'm the one who's got to make sure, like, did you brush your teeth? Did you brush your hair? It's like the routine queen, I guess, is a good thing for me. I'm like, we have to do all these things so that you can have good practices. And you're like, gosh, I didn't want to be that mom. I wanted to be the cool mom. Maybe I'll be the cool mom later, but not now. All right. Dr. Cruz, is there anything else you'd like to add?
About that, just like what I said, trust your gut, get adjusted, find a chiropractor near you. If you're pregnant, go into undercare. If you have a newborn, get them adjusted. They don't need to have any complaint or any symptoms to get them to a chiropractor. So, I mean, if you're choosing for a life with less stress, better functioning of your body, more health, then go to a chiropractor.
There you have it. Thank you, Dr. Cruz, for being with us. If you are in the Northeast Florida area, you can look up Lighthouse Chiropractics in St. Augustine. They're phenomenal. I can attest to it. We appreciate your time, Dr. Cruz, and we look forward to seeing you again, maybe this season. I don't know. Until next time, have fun learning all the things you didn't know you needed to know.
See you later, motherfucker.